Controversies surrounding autistic children aged 1 to 10 often revolve around various aspects of diagnosis, treatment, and support. These controversies reflect differing viewpoints within the autism community and among researchers, healthcare professionals, and advocates. Some of the controversies are named above or in the sheet right here. Early intervention is beneficial for children with autism. However, controversy exists over the use of applied behavioral analysis therapy. Some argue that ABA can be too focused on behavior modification and compliance, potentially neglecting the child's emotional and development needs. Others emphasize the importance of individualized child-centered approaches. The diagnostic criteria for autism spectrum disorder has evolved over time. It went from DSM-IV to DSM-5, leading to the debate about the expansion of the spectrum and potential overdiagnosis or misdiagnosis. Some argue that broadening the criteria may include individuals who truly don't have autism, while others believe it's necessary for a more accurate representation of the spectrum. The neurodiversity movement advocates for the acceptance of autism as a natural variation of human neurology rather than a disorder to be cured. Some within the movement reject medical models of autism and prioritize acceptance, accommodation, and inclusion over interventions aimed at fixing autistic traits. The debunked link between vaccines and autism continues to be a source of controversy and misinformation. Despite overwhelming scientific evidence showing no such connection, this controversy has had far-reaching consequences, including vaccine hesitancy. Controversy surrounding the use of alternative and complementary therapies, such as dietary interventions, supplements, and unconventional treatments, often lack scientific evidence and can be costly and potentially harmful if not evidence-based. There is also an ongoing debate about the most appropriate educational setting for children with autism. Some argue that inclusive education, where a child can be educated alongside neurotypical peers, is more beneficial, while others advocate for specialized schools or self-contained classrooms to provide tailored support. The use of psychotropic medications to manage co-occurring conditions in children with autism, such as ADHD or anxiety, can be controversial. Balancing potential benefits and risks, including side effects, is an ongoing challenge. Research into the causes of autism continue to generate debate. While there is a consensus that both genetic and environmental factors play a role, the precise contributions and interactions are still subjects of research and discussion. Disparities in healthcare access, early intervention services, and educational support for children with autism can be a contentious issue. Advocates often push for more equitable access to services and reduced wait times for diagnosis and treatments and interventions. Controversies can arise when discussing parental rights and decision-making for children with autism, especially when parents pursue unconventional treatments or therapies that are not evidence-based, raising the questions about the balance between parental autonomy and the child's best interest. These controversies underscore the importance of respectful dialogue, collaboration among stakeholders, and evidence-based approaches in addressing the diverse needs and perspectives within the autistic community. Additionally, keeping up with current research and understanding the evolving field of autism can help inform discussions and decision making related to children aged 1 to 10 with autism.